Hi there. Welcome.
Hi.
So we've got some technical difficulties this morning. So Debbie won't be able to join us on camera, but she's here by phone. And we've got Mark who did a great little image here of Debbie. But we are really excited to have you on the show this morning, Debbie. And we've got a really important topic around health equity. And before you introduce yourself, I'd like to just get your perspective and why is health equity such a important piece to you? By the way, Debbie is the Chief Customer and HR Officer for Oncor Electric. And gosh, it's nice that you're here today given all the storms going on right now. But yeah, tell me a little bit personally why this topic of health equity is so important to you.
I guess I would tell you this is important to me for a variety of reasons, and primarily because I'm passionate about the health of our workforce, the health, my personal health, the
Mhm.
health of my family. And for years, I've been involved in an organization in East Dallas, Baylor Scott and White Health and Wellness Center, which is all about helping underserved communities have access to health care that's so important.
Mm.
At the end of the day, if we're all able to access the information and the tools that we need and be healthier, it's good for the community. It's good for employers, by the way.
Yeah.
I'm just very passionate about it. And it's become a personal passion about how, at the end of the day, I own my own health. But if I don't have access to the tools and the information, or feel like I have to choose between my health and something else, that's where the challenge is.
Yeah, absolutely. And by the way, you're my idol when it comes to health and wellness, how fit you are and how much you take care of yourself. In fact, if you've joined us this morning, drop in the chat for us the word if you think everyone deserves to be their healthiest self. So this also allows us to see who's joined us this morning and even through all the storms. So yes, definitely. Good morning, Kim. Nice to see you. Thanks for joining us. All right. So Debbie, I think that there's just it's such a big topic, right? Both from a social perspective. You mentioned employees. Can you share some examples of how these inequities manifest in the workforce and their impact on employees? And I've got one example myself that kind of hits home, but would love to hear your
Yeah.
perspective on that.
According to the guide and the research,
Mm-hmm.
health inequities, obviously, they can result in increased healthcare costs,
Mm-hmm.
increased absenteeism. If I'm away from work or if I don't feel good, I'm not as productive. And often research shows that chronic health issues are prevalent among some really historically disadvantaged groups. I've
Mm-hmm.
seen it personally, and I think it exists in our workforces. If an employee is worried already about how they belong as part of a team,
Mm-hmm.
they're less likely to speak up if they have something going on and if it's impacting their productivity. I think this is even more true with mental health
Oh,
and
absolutely.
people in general speaking up.
Yeah, absolutely. I know coming from a culture where you wouldn't dare say that you're sign up for a therapist. And so I make it a point, like, to talk about our therapy experiences with my family because I'm like, I don't want it to be a taboo topic, for example. Yeah. What about the economic consequences of health inequities? What are your thoughts?
It's big. Again, as a part of the guide, one of the things that they share is if based on the trend by 2040, the US economy impact with respect to healthcare costs
Hmm.
is easily gets to $1 trillion, if you think
Wow.
about that. Now, for years, our president, now the chair of our board, and our CEO, Bob Shepard, has been passionate about health and has always said, as companies, we have to take ownership of that. There's not a government, a program around that's going to make sure that we have the workforce that we need in the future and a healthy workforce. So there's really not only productivity, but healthcare costs to companies. And whatever our service is, in our case, we deliver electricity. And thanks to any of you all that are customers and lost power and your patience, because communication remains a challenge. But that's what it's all about. At the end of the day, we've got to own it. And how do we make sure that we have a healthy workforce? Because the cost to all of us as consumers in the price of goods.
Yeah, that's an incredible number, almost unbelievable. So you keep referencing this guide. Tell me a little bit about this guide. I think this is how this whole conversation got going. And you and Kathy Susie over at Schneider Electric
Yeah.
were like, "Oh my gosh, I can't believe this resource exists." And yeah, what's this guide about?
And American Heart Association is an organization that both Kathy Susie's organization and Oncor have been involved with for years. I'm really passionate about American Heart Association because there's research behind everything that they do. But the Society for Human Resource Management and Deloitte partnered with American Heart Association to really put together this resource guide, because one of the things that's recognized is a lot of us in the HR space are all focused on inclusion, belonging, more than ever. And how do we make sure that all of our employees? So oftentimes, I think we get guilty of thinking our workforce is fine. They have access to good health care, but there's still inequities if we don't think about it, about people really being able to access that care. Do they have transportation? And are we paying our employees to where they can afford those things and they're not worried about even accessing their own healthcare provider?
It's so funny you say that. Actually, Colin McNeese says simple lack of transportation is one key reason for inequities, access to
Yes.
healthcare. Some health plans do provide subsidies for travel. Interesting. Okay, and then welcome Carlos and Kathy Hickson and Philip Humphrey and Susan Neal. Gosh, good to see you guys. Thanks so much for joining us. Okay, so now let's talk a little bit about the benefits to organizations. What's that potentially look like?
There's huge benefits. One of the things, and by the way, I would share with you the great thing about this guide for all of us that has
Mhm.
been put together, and why Kathy and I thought it would be such a great opportunity to share that information is, how do we as chief human resource officers really think about how health equities impact our workforce? And to me, it's just like diversity and inclusion. Health equity should be woven through everything we do. So how do we think about that? We've learned that from our employee resource groups, about a lot of times our employees don't even understand the benefits that we have and how they can access us, whether it's time off, it's the EAP or whatever. The benefits are, at the end of the day, about morale. It is
Mhm.
that sense of togetherness. I think I've seen the things that we've done in partnership with American Heart Association, and it's just a part of our engagement with our employee resource groups, that it just helps mitigate biases as people begin to understand each other and then think about how they can help each other access all those things that a company offers, including opportunities to develop, but more importantly, access to their benefits and things like EAP and what's out there.
Yeah, no doubt it is a challenge, right? Like you're doing your day job and you're trying to figure out the health. It's like a full-time job, just trying to get doctor's
Mhm.
appointments and everything scheduled. So even when you're healthy,
Yes.
yeah,
Yes.
yeah. Let's talk about community. I know you're very actively involved in the community here in the DFW area. I guess the guide maybe talks a little bit about how it can impact the community, and what are your thoughts on that?
Yeah, I think the way that plays out and what we've seen with our employees, and we have Encore Community Cares Councils, because we cover about a third of the state of Texas with respect to our service area. So at a local level, our employees engage with community organizations. And what we've seen is it's a better way for employees to see the impact on the things that they can do to not only improve their health. As an example, when we partner with other organizations, whether it's American Heart Association or United Way or some other organization, we support our employees in being involved in fitness events, so they can submit and we'll pay for the entry at a local level for them to be a part of an event where they're getting out walking or running
Mm.
and engaging with the community and supporting another nonprofit that's helping the community. And so they'll wear their Encore shirts and also have the opportunity to get out and walk together. And of course, the Heart Walk for us is a big way we do that in September every year, and have a large team that includes our vendor partners. So to me, it's about that community partnership. In my own case, involvement in East Dallas with Baylor Scott and White, where they're helping a community that has historically not had a primary care physician. They go to the emergency room for their care. And so, in partnership with the city of Dallas, they created an organization where there's a clinic there and also access to all the great things that you can get from a recreation center. So, I think it's about those community partnerships, because both
Mhm.
it shows employees you care about the community, but it's also a way for them to improve their health. So I think it's just in a big way says together we're going to uh, improve the access to food, access to information, and helping not only the community but our employees get healthier.
That's awesome. So, if you've just joined us, I'm here with Debbie Dennis, Chief Customer and HR Officer at Encore. And I don't know about you, but walking is like definitely one of my top favorite forms of exercise. I used to run marathons. I'm like, okay, the knees can't really handle that anymore. I want to stay healthy and power walking with my Audible on podcast. So if you just joined us or if you're here still, type the word walk in the chat for us so we can see who's joined us here today. Okay, I'm going to jump ahead and let's talk a little bit about community and how our community can get together and support. I hear there's an amazing event coming up. And so I don't even know all the details about the event yet. I know you and Kathy have been working away with American Heart Association to create this amazing event. And it's an all-inclusive event. Like everybody come and join us. We'd love to see you. There's friends that I haven't seen in years. So Lisa Kaklowitz, you should join us. We haven't seen you in a long time. Colin, I haven't seen you in a while. Kim, I know you've been wanting to get involved in something like this. So yeah, tell us, Debbie, about this event. And Mark's been helping us out moderating the questions, but he'll drop in a link in a minute.
Awesome. I am so excited. And Cindy, I want to thank you because Kathy and I approached you about you have such a great network and do so many great things for the CHRO community, just candidly across the nation. Just blessed to know you and be a part of that network. So I just want to tell you thank you for that.
Yeah, thank you.
You're my hero, just so you know. So we're very excited. So we reached out to Cindy and we're going to do this great event. And by the way, if you all are like me, one of the things that as CHRO, we're usually the people that are attracted to being a chief human resource officer are people that are servant leaders. So we tend to take care of others before we take care of ourselves. And in part, this event that we're going to hold, and by the way, it's on Wednesday, June 26th from 2:30 to 4:30, is really an opportunity for us to come together and maybe even spend some time thinking about our own health and well-being. Because if we don't take care of ourselves, we can't take care of all those great employees and those leaders that we work with and our CEOs. So we got to take good care of ourselves. So it's from 2:30 to 4:30, and it's going to be at Blue Cross Blue Shield headquarters, which is in Richardson, Texas. And I'm sure he's posting the details. It's 1001 East Lookout Drive. What's going to be fun about it is, of course, it's the middle of the summer, but we're going to have it. We think it's going to be a little bit of a fireside chat approach. We're going to have my very own CEO, Alan Nye, is going to join us, as well as Jim Springfield, who's the president of Blue Cross Blue Shield, North Texas, or Texas. And they'll do a little fireside chat about their own perspective. And certainly as Jim Springfield, as the president of Blue Cross, very passionate of this subject, as is my own boss, Alan Nye. And he's chairing the Heart Walk this year. So we'll do a little bit of that. And Cindy will moderate. We think that conversation is where we're headed. And in addition, we are going to have, so Kathy Susie's sister, Caroline Susie, is somebody that you may not know. And I was wishing Kathy could be here to talk about her, but she's going to be our guest speaker as well. And I think her focus will provide us some additional insight about health. She's somebody that has been on TV and other things. She's a dietitian, well known, and just really passionate about this topic. One of the things that I was reading her profile this morning, she's passionate about food and wine, right up my alley, but also staying healthy. So I think it's going to be fun. If it's not too hot, we may do a little bit of a walking. Blue Cross Blue Shield so come comfortable. Don't come in your business attire, wear comfortable shoes. And it's going to be about getting together. We actually will have some mocktails, and I'm sneaking in some wine too. So it'll be fun. It'll be a great opportunity to network, great opportunity to share ideas and thoughts. Certainly we'll spend some time. Probably they will have a speaker there as well, just really on this topic of health equity and why it's so important and a huge opportunity for all of us.
No, that's awesome. It's going to be so much fun, Debbie. And one of the things that I noticed in the report was that I can't remember the exact number, but the majority of CHROs and heads of HR are not aware about health equity, right? So they surveyed, I think, 4,000 HR leaders. Wow, that's crazy, given that you guys are sitting in the middle of people and health and welfare and diversity. Yeah, I think it's worthwhile both for your brain as well as your body and your soul to be together. All right. Debbie, thank you so much for joining us. Do you guys have any questions? Feel free to drop any questions that you might have in the notes. I have some that came in from somebody who wasn't able to join us, but they were wondering, About future plans,
Mm,
Debbie. Does the guide talk at all about what are the trends that are developing that you foresee in this area?
yeah. And I think one of the big trends is we all know data drives everything. At the end of the day, it's data that's going to drive business decisions. Really, the resource guide talks about how do you make health equity a part of your overall business strategy
Mm,
and weave it through what you're doing. Generally, and historically, a lot of times it's about the cost of healthcare and how you keep it down and manage it. At the end of the day, I think if we all reel back and intervene early and make sure that people have access to care, I'll give you a great example. Mental health is top of mind for me right now. And by the way, our teams are working harder than ever. And I worry about how hard and safety for our line workers is it's dangerous the work they do. And they're working 16-hour shifts and
mhm.
all hours of the day. And so just from a mental health standpoint, just coming off of Mental Health Month, one of the things that we saw last year when we really stepped up our game on mental health is the percentage of employees that access our EAP went from, and I'm going to look down at this. So in the second quarter of 2022, we had about 4.1% of our employees that were accessing EAP. So in the second quarter of 2023, that went up to 22.5%
Wow.
that were using EAP. Now, you might say, oh, that's bad news. What was going on? Actually, what happened is it was primarily driven by activities that we were doing to really during Mental Health Month in 2023, where we had employees sharing their actual stories. And this year, we did a panel with men who were telling their own personal stories. And oftentimes for men, I got to be strong, and still about 70% of our workforce is male. And to have a panel of their colleagues speak and tell their stories as part of Mental Health Month, I think that's what's driven it. It's like people say, okay, that's a great service. And I need to be comfortable. I don't need to be worried about accessing that and saying I need help. So I think the future, that's what the future to me looks like, Cindy, is
Mhm.
how are we going to move that needle so that not by 2040 it is that big $1 trillion jump, because that's a scary thing. We all think about what the future looks like. So I think that's where it's going to be, is driving it as a part of our business strategy and looking at it differently, listening to employees and using employee resource groups and other parts of how we're trying to help people belong, to listen to employees about how we can create better access and change our benefits to be what employees need
That's
to be
awesome.
their best self.
All right, Debbie, thanks so much. I don't know if we know how many seats are going to be available, but I suspect it'll be limited. So we've got the link dropped in there. Make sure you jump in. If you don't know Debbie Dennis, you have to know her. She's amazing. And
Um,
I'm honored to be able to do this with you.
Thank you. And Kathy, Susie couldn't be here. It'll be awesome. We would love to see you all there. I'm passionate about this. I know all of you all are too. And I can't wait. If I haven't met you, I hope to see you there. It'll be awesome. So thank you all.
All right. Thanks. Take care.
All right.
Bye,
Bye
y'all.
bye.